Yes, sir. Yes, sir. Yes, sir. I'm back at it. It's been a while since I dropped a video. It's been a minute, but I'm back at it. I didn't want to just drop any type of video. I wanted it to be something I cared about, something that's good quality, and something worth knowing. For sure, worth knowing. A lot of people walk around here with their eyes closed, not understanding a lot of what's happening around them. And I don't blame them. You know, it's better to use your senses to focus on keeping yourself alive and to block out anything that might distract you from this. And I get it. I get it. Paying attention to too many things, people just don't want to, they'd rather focus on their own little circle, that small corner, whatever, but it's their corner, it's their circle. That's what they focus on. But for those who want to know as much as they can, for those who want to keep themselves informed, I've got you. There's something. Let's keep it. Recently, I was watching an article video by ENCA. It's a news publication, a big news publication in South Africa, and they were highlighting something that touched me. I'll say why it touched me, but let me go into it. Right. So they went and said there's a healthcare crisis. I agree with them. It makes sense. But let's continue. Recently, there was a story on ENCA highlighting the state of hospitals in Gauteng. The headline was that thousands of patients infected at Gauteng hospitals. After a person has been admitted in hospital and is now a patient, they end up getting infected by other sicknesses aside from the one they admitted themselves for. Let that sink in for a minute. Let that sink in for a minute. I mean, anybody, when they go to a hospital or a clinic, they want to get attended to and leave healthy or leave not having contracted any extra sicknesses. So people are going in reverse. Things are happening in reverse. You go there sick, you get more sick when you're there. That's not a hospital. That that's something else. That's something else. Let's carry on. Let's carry on. The Department of Healthcare has admitted that they have staff shortages. The staff has to cut corners. They have a shortage in basic things like soap, and they don't have enough laundry. A hospital having shortages of this scale in in a so-called developed country like South Africa. It's one of the reasons why so many I don't know what you'd call them, smarter people, I guess, would come out and say that South Africa is in between a first world country and a third world country because of these types of dynamics. How can a hospital not have enough laundry and things like soap? These are basics. And if there's staff shortages, people will obviously try to cut corners to get to the end goal. But is that always going to be the best way to do things? I don't think so. There's most likely going to be consequences for cutting corners. Now, you think that this is just going to be an up in the air story. They're not going to throw anyone under the bus. But in such a terrible government, with the way they're doing things, they they know that people are always looking for someone to blame, and they will not take that bullet. So, Charlotte Maxeke Hospital was put on blast as being the worst infected by this. A 1 in 10 patients admitted in last year picked up an infection. Those are scary statistics. Those are scary statistics. 1 in 10. 1 in 10 people that went there to have their problems, their sicknesses solved, ended up picking another sickness while they were there. How many people go to a hospital every week if it's 1 in 10? So, experts say the numbers are underreported. They cite poor infrastructure, not enough ICU beds, not enough infection and prevention control elements, not enough water, and overworking of staff members. a hospital in South Africa. People jumped the flipping border to get here to use these hospitals, and this is what they are going through. It's when you read situations like this where people are being overworked, the staff members are being overworked, there's not enough ICU beds, there's not enough laundry, basic things like water and soap are lacking. I understand why Operation Dudullah is doing what they're doing in the public hospitals and clinics. It's the system is buckled, it's buckling, it's about to break. And the people who be feeling the impact of this is South Africans and not the immigrants slash foreigners who'll be using these facilities. That being said, I'm from a public hospital. Recently so, I was there and I got helped by a foreigner doctor, both white and black. Foreigner doctors, they both weren't South African, but they were working in a public hospital, helping me, a patient. When you look at it in a situation like that, I repeat what I said earlier, where the way Operation Tutula is going about solving this problem is sowing seeds of hate. I'm not saying they're wrong. What I'm saying is that this the way of going about solving this will have consequences, and it's not going to be pretty for the South Africans. Now, I watched the episode they released on the Penwell show, where Operation Tutula members, the head in command, I don't know why they use such titles, commander in chief, head in command. These people are not in the military. It doesn't make sense. Why such scary titles? But they were explaining their side of the story, explaining the problems they went through, citing that they see countless South Africans being being forced to wait or sometimes not receiving healthcare because whatever healthcare was there got finished or depleted by what would be foreigners or immigrants. And I don't know, when they come out and say their side of the story, it becomes a different type of conversation because one side is fighting for the rights of the South Africans, but the same South African government will go and hire these people to come work in these institutions to help who? South Africans. It's insane. I don't know. I don't know how to go about solving this. With that being said, though, I think we need to build more hospitals. We need to build more clinics. We need to capacitate more nurses and doctors. Yes, there are nurses and doctors who have degrees and qualifications, but I don't think they want to come work for what would be a dilapidated public hospital. I think give these people a fresh start. If they think they can do a better job, give them a fresh start, a new hospital. Let them be the first employees there with the first qualifications and everything. Give them a fresh start. Let's see if they can do better. And this thing of subsidizing hospitals, I don't know. I don't know because the people themselves don't control the supply chain of the medicine. So I don't know. I don't know. Subsidizing should be better if people controlled more. I think if the people of South Africa controlled more, subsidizing would be better. But now, the way it stands, I don't know. I'm gonna leave it there. I'm gonna leave it there for now. Um, Let me know what you think. Share this video, like, comment. Um, yeah, tell me what you think about this whole situation. But moving on to the next, because I didn't leave with just one. But moving on to the next story, the Ghanaians are protesting against Nigerian immigrants in their country. I don't understand why so many countries have a problem with Nigerians. I what are Nigerians? Okay, okay, let me go into it. So when I try to find out why specifically the Ghanaians, because these are Africans themselves, Ghanaian, the people from Ghana, the citizens of Ghana, the Africans themselves. Why are the people of Ghana protesting against Nigerians? When South Africa was protesting against Nigerians, foreigners, we were labeled xenophobic. But now that Ghana is doing it, it's not even making a big headline. I had to really dig deep to find the story. I don't understand. But here's the reasons why. Here's the reasons they claim why. There is an underlying tension from decades of reciprocal expulsions, like the Nigerian 1983 Ghana Must Go campaign that forced out over 1 million Ghanaians from Nigeria. It's one of those nuggets of history that most Africans don't know about, especially South Africans. Like especially South Africans, I think the whole Ghana must go protest campaign that happened in Nigeria back in 1983 rubbed Ghana off the wrong way. Ghanaians have never forgotten about that. And now that Ghana has sort of improved as a country, Nigerians now coming there to exploit the economic opportunities. The Ghanaians are they going back remembering those vibes, those actions, that history. And it doesn't look good for Nigeria. African countries fighting. And I don't know, because this one is not being labeled as xenophobic. So what is it? Another reason, and this one I think everyone complains about Nigerians when it comes to this, but it's criminal activities, right? Nigerians are accused of being involved in armed robbery, kidnapping for ritual purposes, and prostitution. This has made Ghanaians extremely negative against Nigerians. They now see Nigerians as just some type of exploitative parasite in their country that doesn't serve them. And they are going through extremes, protesting, going on social media, publicizing that they do not want Nigerians in their country. But now, my thing is, this is not unique to Ghana as a country. There's other countries, your Europe, your America, your UK. They also don't want Nigerians in the country. Your France. So what is it with Nigerians that is so bad of all the Africans that they get put on that pedestal of rejection? It's a really high pedestal of rejection. I think I think as overpopulated as Nigeria is, they still are the second largest economy, right? So there has to be some type of acknowledgement in their work ethic and hustle mentality that they have. That being said, Nigerians don't respect the laws of the countries they are citizens in. They don't respect the laws of the countries they visit, they go into illegally. They don't respect these laws. And it's turning the people of those countries against them. They need to fix their ways as a people, not just as individuals. And this is not to say that there's perfect people. There's no perfect people. There's other people like the Nigerians are not the only people South Africans complain about. But I do think that Nigerians should try to organize the group themselves and sort out these problems rather than having other tribes and nations getting involved and trying to solve these problems for them. I think that's better for Nigeria. Anyway, that's it. That's it. It's a wrap for me. I gave it my all. I made sure there was a good episode. Um, Keep watching for the next one, and I appreciate those who have been watching. I will never give you some boring information. I'll make sure some good stuff comes too. Anyway, it's AP. I'm out. Cheers.